Good afternoon. My name is Daniela Sefora Goeieman. I'm a clinical associate, so happy PA week if they're physicians associates that are here at the conference, and a researcher from South Africa. So this was a study that I did as a prerequisite for my MPhil in family medicine. So I believe in research as a form of advocacy and social medicine for social justice, which is why my work is in the discipline of family medicine and primary health care. So this table is taken from the 2023 World Drug Report, and it's clear that there's a concerning lack of prevalence data for our region. And in our country, if you ask people, they'll say we're going through the most when it comes to substance use and addiction care. And whilst we're currently going through a lot of policy reforms and much work is being done to find evidence-based interventions, it's happening with no recent national prevalence data and very little research on how people use drugs. So whilst establishing the community-orientated substance use program back in 2017, we used the community-orientated primary health care approach to deliver harm reduction services in one of the major metros in South Africa. During that time, I had a disquiet when I noticed that very few women were accessing our services, and I thought to conduct the study to find out which women were we able to reach as well as we were able to retain. What we found in our secondary data analysis of the paper-based files in the OST database, which was collected from the program's inception up until January 2022, in COSUP, is that participants were unemployed, most falling within the 20 to 21 years of age range, and accessing services from community-based facilities. 1 in 3 women had experienced intimate partner violence, and that prevalence was higher than what was the national prevalence reported in 2017. 19% were pregnant whilst in OST. And because of time, I'm going to focus more on the communicable diseases. So we found that 37.2% of women were living with HIV, although 24.1% had an unknown status. And TB, we were able to screen about 72.9%. With regards to Hep C prevalence, of those that had HIV, 75.7% were on ART. When it came to Hep C, 81.9% of the women had an unknown status. And that's because historically, COSUP's primarily addressed unregulated substance use. And so it wasn't addressed for infectious diseases. So that could explain the low screening and testing and treatment enrollments for these communicable diseases. Retention in OST was significantly associated with age, knowledge of HIV status, and what we thought was perhaps the risk and diagnosis of HIV akin to pregnancy seen in other studies might have heightened the health consciousness, leading women to take steps towards enrolling in OST. Oops, go back. So the so what, right? So the so what for us was about evaluating the services that we were providing, specifically in an area of successful policy reforms evident in the South African Drug Master Plan and our HIV, TB, and STI strategic plans. And so we have to consider women who use drugs as a special subgroup within the population of people who use drugs. And I think for me, on a personal note, as I've been transitioning to health science education, is to involve women from the community to help in embedding harm reduction into undergraduate curriculum for health science students, hoping that using a pedagogy of radical tenderness, we will have an evidence-based and transformative curriculum that promotes the development of practical skills and the cultivation of a compassionate and socially just approach to addiction care. You can scan the code to your left, yes, at the top, to read a little bit more about the study. It's more currently we just have the author manuscript, so we're just waiting for it to be published. And then this particular one down at the bottom here is more about our community-orientated substance use program. Thank you.
Any questions? Andrew.
Thank you.
Well done. Have you seen any positive change since when the project started to where we are now around services for women who use drugs?
Definitely, and what I would encourage is that if you do have time, I think the qualitative aspects are always quite important. And there's a poster in the banqueting hall, I think number 221. A colleague did a qualitative study, particularly looking at the perceptions of women with regards to accessing OST. And looking at the community projects that have been done since we started in 2017, I think there's been quite a significant progress. As also, although we didn't report on it, but from 2017 up in 22, there was an increase in the number of women that were being enrolled and accessing services from COSUP. What I will then also just like to highlight that this doesn't typify all women that use opioids, because we didn't look at those that weren't accessing OAT, so those that were just coming for needle syringe program.
Thank you so much.